Thank you for having me. I was going to wear my sunglasses and I forgot. Somebody said the lights were bright. Jay and Keith, again, thank you for inviting me to speak at this conference. It's always an honor to speak at this event. It's 9 o'clock in the morning. I am dressed, I think, as Darth Vader. Not quite sure. I know I have the wrong color gadget. I don't remember what it's called. I hope you had enough coffee because I'm going to stand up here and talk to you about PSAs and DREs at 9 o'clock in the morning dressed like this. So I hope you're ready. I've been speaking at self-funded conferences for roughly 20 years, and this is always my favorite one. Like Adam, I spoke at the very first one and have been back a few times, and it's always my favorite one to speak at because I just feel like we're kind of all cut from the same cloth. We're all heading in the right direction. And it's just an honor to be among friends and colleagues. Lynanne and her team, awesome job. LA and I have worked together for roughly 20 years. We started out at the same TPA, headquartered in Billings, Montana over 20 years ago. And it's always fun to watch her pull together a theme of an event. In fact, when Adam was speaking, I was actually visualizing him with a horse head on because one of our very first events 20 years ago, there was a horse theme involved. And so this is the first time that I've ever dressed the part for Lynanne's theme, and so it's been kind of fun to do so. And I'm going to explain why. In 2018, July of 2018, I was speaking at the HCA conference, and I met who would become my future husband, who's here with us today, at this conference. I was living in Montana at the time, he was living in Wisconsin, and when I went to Wisconsin for the first time to visit, he asked me if I would like to see his collection. So he brought me into this room, floor to ceiling, numerical order, a Star Wars collection. Now, I don't think I had told him yet, but at that time in my life, mid-late 40s, I hadn't even seen a full episode of a single Star Wars show, which is why I don't remember what the name of the gadget is called. Here we are. We no longer live in Montana or Wisconsin. We live in the Upper Peninsula of Michigan, and we have a rider policy on our homeowners insurance policy because we have a Star Wars collection. I couldn't think of another opportunity where I was going to be able to dress like this at 9 o'clock in the morning, talk about PSA exams and DRE exams, and get away with it. So thank you for indulging me. So why am I here and what am I here to talk to you about today? As mentioned, I am an attorney. I've been an ERISA attorney for over 20 years. I specialize in self-funding. Fiduciary risk management does all things self-funding. And then in 2017, out of a necessity for my clients and at the request of one specific client, I started a company called VezaHealth, V-E-Z-A. Veza is a Croatian word that means to connect, and my goal was to connect providers, patients, and plans together so that we are combating the issues that we're all still discussing today. So VezaHealth was started as a remote second opinion company primarily, and it has morphed into kind of a white glove, high touch concierge navigation company that also does remote second opinions. When I look at my aggregate data from 2017, here's what jumps out at me. Everything is within over the 30% bracket. On surgical avoidance, we've avoided over 30% of the surgeries that have come to us. Misdiagnosis, over 30% of the patients that we have had a relationship with were misdiagnosed when they came to us. That's startling. And over 30% of the patients that we worked with have received a change in their diagnosis. So you don't know the power of the dark side. I think this is where we can all agree that many patients reside, is in the dark side of healthcare. We too get caught up in the dark side of healthcare. There's a FMMA provider, Dr. Imes, that I recently worked with personally that was phenomenal in helping me avoid probably a handful of doctor visits. And we did it all remotely, and it was the best outcome that I could have experienced as opposed to going to one of the large facilities. I have some cases that I'm going to talk to you about from a visa standpoint that are somewhat recent, and it kind of brings home the value of not only Veza, but some of the other vendors that are in this room today. I have a couple cardiac patient cases. One of them is one of my own employees. She was having some cardiac issues. She ended up in the ER multiple times. She was being treated at Mayo Clinic. Most employees that are in any health plan would think it would be a privilege to go to Mayo Clinic. And she was still suffering and was uncertain as to what her diagnosis was and what to do. So she sought a second opinion through Veza, the company that employs her. And the physician that did the second opinion recommended a certain image be done on her. She took that information back to her doctor at Mayo, and he actually apologized to her for not recommending that she have that done. And I thought that was an amazing thing. This same employee is somewhat new to our industry. She's hasn't been she hasn't had as much experience with self-funding, and as we all know, it's a different beast, right? There's enough acronyms to kill us. There's many players. When you're looking at one self-funded health plan, they've got various vendors, who plays what role, and so it's somewhat confusing. So I'm continually trying to educate my employees on all the pieces and parts of self-funding. But in the middle of the night one night, I woke up and I thought to myself, this is the perfect opportunity to explain to her the difference between VezaHealth and a traditional medical management company. So the next morning I called her and I said, I have a question for you. She's covered under a self-funded health plan at her husband's employer, large organization, international organization. So I can guarantee you, I haven't verified, that they're with a BUCA, and they have a BUCA-sponsored medical management program. So I said to her, oh, what was the name of the nurse that called you from the medical management company for case management purposes when they saw that you had multiple ER visits and some cardiac claims? And there was a pause. I'm like, do you remember the name of the nurse that called you from case management at from your health plan? A pause. She's like, nobody's ever called me. And I'm like, exactly. That is why VezaHealth is so important for our clients. And I don't say this to diss all the medical management vendors out there. I used to work for a TPA. We had our own medical management vendor, but they're just not capable of doing the high-touch service that our people need. You can't have multiple ER visits, cardiac events, cardiac claims, and not get a single phone call from a nurse from your medical management vendor saying, how can I help you? We look at claims proactively before they even end up in the ER or in a doctor's office to see, Mr. Jones, I see you've had a spinal injection. I know that they're going to be recommending surgery at some point, right? So let's talk about it before you get on a pre-cert report. But it was the perfect opportunity for me to talk to her about what was the name of that nurse? And I think it hit home that, yeah, we are way better than any other medical management vendor out there. Cancer. This one hits pretty close to home. I forgot a cardiac one. This one's interesting. So I'll use name Richard. This individual had an implant. He was being treated by a large facility, and it was connected to some vendor that was supposed to track what was going on with his implant. He had an event. He ultimately passed away. A day or two later, his wife received a phone call from the vendor saying, oh, I see that your husband had an event. How can we help you? She's like, well, my husband has died. And the lady said, I'm sorry, we were closed that day. The facility has been harassing this woman for the last 7 months, trying to get $1 million out of her to pay for the balance bill of her husband's health plan, who is now deceased. So fiduciary risk management comes in, and we start negotiating these claims. On one particular day, and I wish I had a picture I could show you. I have one on my phone, I just didn't think of it. They sent her 240 letters in the mail addressed to her husband asking for the $1 million. There was a stack of envelopes. She sent me a text picture. 240 envelopes they sent to her asking for an envelope per claim line, asking her to pay the $1 million. So needless to say, she got her actually brother-in-law got us involved. We're negotiating these claims, and I was hoping today I'd be able to tell you, so it's probably not going to happen until next week. But I'm willing to bet that I'm going to get that entire $1 million written off, and that will be a happy day. So cancer, This is where we get into PSAs and DREs. Prostate cancer, one of the leading cancer diagnoses for men, right? Most men don't have any symptoms. Your doctor's looking at your PSA levels to see if they raise. And many doctors are still doing DREs, digital rectal exams, right? The American Cancer Society still recognizes that as a valid testing tool. The United States Preventative Task Force has decided that it's not. Anybody here on that task force? Because I'd love to talk to you. Right? The United States Preventative Task Force has decided that DREs are no longer valid. One of the main reasons being the psychological harm that is caused by a false positive is too great. So they don't do them. Many doctors don't do them anymore. You speak to certain doctors and they're appalled by the thought, and then obviously there's doctors that don't do them. So this patient's name's Pops. It's my stepdad. It's been my dad for 38 years. We've never talked about DREs at the Christmas table. Never brought it up. I've heard a lot of jokes about DREs. I'm now an expert. His doctor doesn't do them. Stopped doing them as soon as the task force said he didn't have to do them anymore. PSA normal, PSA normal, PSA normal. Something happened in December, don't know what. Somebody did a DRE and said, holy shit, right? My father calls me and says, I need to have this image done, and I can't, it's December. I can't get in till March. I'm like, well, that's unacceptable. And I didn't even know the whole story yet, right? So Visa helps him. We get him in 3 weeks. He has to drive 2 hours to Cody, Wyoming. I get him in for the exam in 3 weeks. Because we're involved, I get the records back right away, right? Pops, stage 4, metastasized to his ischium bone, because the psychological harm of doing a DRE was too great on a patient to have that be part of the protocol. So, all you men, if you're not getting your DREs, you're gonna go get them because it's obviously an important tool, right? Stage 4, incurable, has a 23% chance of living more than 5 years because some doctor decided that that wouldn't be appropriate anymore. Okay? There's your DRE. What else do I got for you? Rheumatology. Within the last 5 months, 2 patients, one diagnosed with lupus and one diagnosed with ankylosing spondylitis. One more time. Ankylosing spondylitis. That. Diagnosed with that. One of our Visa doctors that we work with from a rheumatology standpoint, get her involved, 2 remote second opinions, both misdiagnosed. They were all on medication to treat those 2 diagnoses. Now they are treating their symptoms through diet and exercise, and nothing else is needed. Not only are we paying too much for healthcare, we're paying too much for healthcare that some people don't even need. And over 30% of just my patients are misdiagnosed. We have to start doing things differently. GI, one of my clients who's here in the room today, they had a patient that was having GI symptoms, 35-year-old man, been to the ER 15 times in 1 year. 15 times. And no doctor or anybody involved in his care said, you know, we got to step back and see what's going on here. Works with our doctor, our nurse, and our health coach. And within hours, they were able to help him. It was GERD. He had GERD. They gave him some tools. He now can, if he has a flare-up, he can fix it on his own. He hasn't been to the ER since. Can't even imagine the savings on that guy. Diabetes. Dr. Thangadu is an amazing doctor that we work with so closely, and I love her dearly. We worked with her on a case for a client, and a patient was misdiagnosed with diabetes. He was told he had diabetes. He was prescribed insulin. He was told to go home and come back in a year. He didn't even have diabetes. And ortho. Ortho's kind of always in our bucket of success stories, and all of the surgeries that we avoid. Like I said, over 30% of them have been avoided. Every single spine surgery that has come to us for a remote second opinion has been avoided in its entirety. There's one exception. There was one gentleman that came to us and wanted a remote second opinion on his spine surgery, and it came back and said, you should not have this spine surgery. He's on the hospital board. He felt bad. He went ahead and had the surgery. Last month, he was lying at home with a spinal leak. I'm speechless at this point, I guess. Okay, so the purpose of sharing these stories with you, the traditional approach of what we're doing from a self-funded health standpoint, healthcare finance, healthcare in general isn't working, and we all need to be thinking of doing things in a new way. And that's why this conference is great, because that's why we're here. Everybody's thinking outside the box, collaborating with great partners to do things differently. So my ask of you, I know there's some stop-loss carriers in the room, is the traditional URAC accreditation, check the box, URCMDM program still working for you, right? We've been doing it my entire professional career, and we're just checking boxes, medically necessary, looking at criteria, and we're done. We're not doing anything further. So is that still working for you, right? And when I look at the claims that come across my desk from a fiduciary risk management standpoint, and I see a $23 million birth in California, and I see a $15 million 2-month inpatient stay in Texas, my guess is no, it's not working. So I encourage you to partner with vendors that are doing things like Veza to try and combat not only the cost, but whether or not the treatment that people are receiving is appropriate. Brokers and consultants, differentiate yourself. I mean, I get so frustrated with some of the brokers that I have clients that they're using because they're partnered with the vendors, or they're partnered with the commission, right? And they're not doing things that are in the best interest of their plan. Like Adam was talking about, doing these mandatory workshops. That's a lot of work. That's a lot of work for a broker and a consultant to do, right? But we have to start doing things differently because the costs are out of control. And when you partner with a PPO and you're paying a percentage off of an unknown number, all they have to do is increase their bill charges to get more money out of you. So I don't know why this day and age anybody is still partnered with a PPO. I absolutely don't understand why. And it's one of the reasons is it's a lot of work. I remember I had a client or a prospect out of Minneapolis that I was working with. And at the end of the conversation, they just couldn't budge. They couldn't do anything different. And he's like, if I don't have that Blue Cross Blue Shield logo on my card, my employees are going to freak out. I'm like, well, then shame on you. Shame on you. You deserve all the claims you're going to get. So consultants, I hit on you. And then providers in the room, thank you. Thank you for doing what you're doing. And congratulations on being able to go out and actually practice medicine. I thank you personally, and I thank you professionally. And FMMA and Jay and Keith, thank you again for having me, and thank you for starting this journey almost 10 years ago and allowing me to be on the journey with you. Thank you so much.